No, not play, record.
So today I'm going to talk to y'all a little bit about the medical condition called pre-eclampsia. I just want to give y'all some information about it because a lot of people don't know a whole lot about the disorder because it's fairly rare. Pre-eclampsia affects 5 to 8% of all pregnant women. It comes on kind of by surprise for people who don't know about it, like it did for me. That happened to me in my second pregnancy. So I'm going to tell you about the causes of preeclampsia, the way it's diagnosed, the treatment, and who's at risk, and what you can do to maybe prevent it. All my sources are found at www.preeclampsia.org, www.nin.ency/medline/ENCY/0000898.htm, and www.americanpregnancy.org. So, preeclampsia, we're going to talk a little bit now about what it is and how it's diagnosed. It is a medical disorder that shows up around the 20th week of pregnancy or later. It's diagnosed during a routine doctor appointment. What happens is if you're pregnant and you're past 20 weeks and your blood pressure is high, and then you have to go and do like a pee test every time you're at the doctor. They test it, and if there's protein in your urine, then you have preeclampsia. What that really means is that you have to be monitored further in your pregnancy and more often, and you have to kind of change a couple of things, and you have to go see the doctor a lot more and have ultrasounds and see how bad it is and things like that. The symptoms of preeclampsia can be completely asymptomatic. You may not know you have it until you're like, oh, hey, you have preeclampsia. Or you can go in and you can obviously have high blood pressure. You can start having headaches, like migraines, all the time. Vision changes where you see blurred vision or floaters in your vision, swelling, significant weight gain, and sometimes you can have symptoms of a panic attack too. It feels like you're panicking all the time. Preeclampsia does not have a cure other than delivery of the baby. There's nothing that can stop it other than that. You just have to wait it out until your baby is born. But it can be treated. Mild cases of preeclampsia can be treated by diet modification, by a reduced sodium diet, not eating a lot of fried foods or fast foods, drinking plenty of water, 6 to 8 glasses a day, resting frequently but laying on the left side of your body so that your body weight and your pressure is not on your main arteries and your main nerves. And increased prenatal visits, so you go see your OBGYN a lot more. Moderate to severe cases result in the delivery of the baby, which is what happened to me, and my baby was born at 34 weeks, bed rest, and then upon being admitted to the hospital, they generally start an intravenous distribution of magnesium sulfate, which is a drug to prevent your body from seizing and your organs from shutting down. The risk factors for getting preeclampsia include pregnancy of multiples if you're pregnant with twins or triplets, a history of diabetes, high blood pressure, or kidney disease. It also includes obesity and being over 35 when you are pregnant. However, it can also occur when there's no risk factors. It just can happen randomly. It can be prevented by eating well and taking care of yourself, by working out regularly, by already eating a reduced sodium diet, and not making sure you're in shape and going to your doctor regularly. But sometimes it just happens and it can't be prevented. And also, if you've had preeclampsia in the past, you're at a higher risk for having it in subsequent pregnancies, and it can happen sooner and be worse. My goal today was not to scare any of our pregnant audience members, and I'm so sorry if I did, but more to educate you on what you can do to take care of your body and prevent yourself from getting this disorder. I've informed you about how preeclampsia is diagnosed, the symptoms, the treatment for preeclampsia, risk factors, and the potential prevention for preeclampsia. Again, you can find more information at the sources I mentioned earlier, and thank you for listening. Did I go for 4 minutes?